All right. Poster number 2 for Saturday at SWAPA.
Yeah.
So this is Stephen and Jacob. For my students, it's fine. I
Yeah.
remember who they
We
are.
don't mind.
So they want to tell us a little bit about their study. So I'll let them go ahead and get
Yeah.
started.
So during the process of typical aging, cognitive decline can be inspected in certain areas like memory, attention, and executive functioning. When that decline becomes what's outside of what is expected for age and education, becomes known as mild cognitive impairment, or MCI. MCI is known as a syndrome that's often transitional between typical aging and various dementias such as Alzheimer's. And actually, the risk of developing MCI only increases with age. And what's worse, no medications have been shown effective in treating it. What's very interesting, though, is that mindfulness meditation has emerged as a non-pharmacological and cost-effective treatment that has been shown effective in improving attention, memory, and executive functioning in older adults, as well as improving depressive and anxiety-related symptoms, which can serve as uh, markers for cognitive decline or progress it or worsen the progression to various forms of dementia. So what we're looking to do is um, we're going to get a baseline for cognitive functioning with the CANTAB, and we'll also use the Geriatric Depression Inventory and the Geriatric Anxiety Inventory to get a baseline for depressive and anxiety symptomology.
So we have 3 groups in our study. We're gonna have an MCI with mindfulness meditation, our intervention group. We're gonna have another group with mild cognitive impairment, no intervention, no mindfulness meditation, and then cognitively healthy and no intervention group, kind of as like a reference or comparison group. So the plan is to have 8 weeks of mindfulness meditation intervention with possibly a 4-week baseline test or mid-treatment test. And then after that, we're going to have all of our data to analyze. We're going to analyze our data using a one-way repeated measures and MANCOVA, since we have many different groups with 2 dependent or outcome variables. And our covariates that we're going to be looking at is age and education, which is very common in leading to cognition over the lifespan. Exposure to mindfulness meditation, gender, ethnicity, neuropsychiatric symptoms as well, and lifestyle factors such as possibly we could look at nutrition as covariates. So the significance of the study is that we're hoping to fill an existing gap to determine whether or not mindfulness meditation is an effective treatment for atypical cognitive decline before it reaches to the stage, to a demented stage. As we've said, as the older population grows, older adult population grows, so does the prevalence of atypical cognitive decline. So with this fact in mind, experts agreed that mild cognitive impairment is the stage to where we should gear treatment towards, where we can have the best hope of seeing improvement or attenuation of decline. And as we said already, mindfulness-based interventions, they're non-pharmacological, and cost-effective treatment option. So
Yeah, so ultimately our goal would be to include mindfulness meditation, diet, and exercise changes as a treatment program for MCI. So that's our ultimate goal.
So you guys are both second-year clinical psychology students. Like, obviously, your goal is to inform practice, like better clinicians, better
Yeah.
like patient outcomes. Like, do you see this making a really big step forward, and do you think that you will continue with this work?
Absolutely. So for me, I think it really hit home. And I know I told you this story.
Yeah.
I had a family friend who was diagnosed with MCI, and I was like, "Oh, I'm so sorry. What are they doing?" And they said nothing, which broke my heart, and I was stunned.
Right.
I was truly stunned.
Yeah.
Like, so if we can show positive results, then yes, this will be a lifetime endeavor. And I think informing practice and making it so that others who are diagnosed with MCI actually have a treatment protocol, yeah, that would mean the world.
yeah, it's going to further improve the idea of holistic treatment, treating
Yeah.
different domains of life, is all the different lifestyle factors.
Exactly.
Yeah, we talk a lot in our lab about treating the individual,
Yes. Yes.
not treating this like amalgamous thing out there, right?
Yeah,
We
yeah.
treat the individual, and individual differences matter.
Exactly.
And things like this allow us to get in tune with ourselves, and help us understand this. Okay. So one more question for
Yeah.
both of you, unrelated to the research. So you're clinical psychology students. You're headed out there. You're on practicum internship. We're 2 years in. I won't ask if you would do it all over again, because the answer is yes.
Yes, of course.
What advice do you have for maybe students or people who are thinking about entering the field of clinical psychology?
Honestly, I would say lean in. Like, the process is what it is, but it's worth it. You know, we all have goals, and this is how we get to our goals. And I think for me, if I can help make the world a better place, selfishly, that's what I want to do. So I feel good doing it. So
Oh yeah, I think have self-awareness. This is a very tough program and it's a very tough progress, and it can be emotionally and mentally draining at times. But like we had a conversation yesterday, and he said that if no matter how tired you are, if you wake up in the morning and you feel like you're in the right place, then it's a sign that you should keep pushing forward, and that's how I feel. So just be aware of that.
Thanks, guys. I appreciate it.
appreciate it.